Hey guys, welcome to episode 10 of Optimal Function. I'm Dr. Craig Banks. I'm here with my co-host, Dr. Jim Morgenstern.
How's it going, guys? Thanks for tuning in.
And our special guest today is Dr. Nick Colosi. He is the founder of Smart Tools, and we just did a blood flow restriction training session here at Alpha Legends Gym in Twinsburg, Ohio. So thanks again to them for letting us train here. But Dr. Nick's going to talk a little bit about the background, the science behind blood flow restriction training, and what you guys might be able to expect if you ever decide to try this on your own. We're going to address this not only to typical folks in the gym, but also some of the providers out there that might want to try this for their patients as well. So Dr. Nick?
Yeah. Well, thanks for having me, guys. We're based right here in Cleveland, Ohio, so it's a quick drive down. So we started a company in 2014. We started with ISTM tools, as you guys know, you guys have been using it, and soft tissue mobilization tools, and that started in 2014, and right when I got out of chiropractic school. And, I was kind of doing both, practicing and doing the tools at the same time. The tools are right here, made right here in Cleveland. And, they're very high quality. And, it's an extremely popular technique amongst healthcare providers. And now it's getting into, the bodybuilders, strength coaches, things like that. So, and then we stumbled upon BFR about 3 years ago. So 2016. And we started looking at it, and Ed LaCara, my director of education, he was just like, hey, this is something you might need to take a look at, just because the research is very solid on it. There's a ton out there. The implications for rehab is just it's insane, just because the goal is to lift lighter loads to mimic heavier loads and get the same result, which has huge implications for obviously rehab, but and other things as well. So we started looking at it. I was like, okay, let me think about it. I started using some other cuffs that were out there on the market right now, just on myself, and I loved it. I loved the way it felt. I loved the way it was easy to use. It was portable. You could travel with it, but they had a lot of drawbacks. There were some that are, tethered. So, you got to keep the gauge attached to the cuff at all times. So then I was working out with a cuff and a hand pump basically in my pocket, which is kind of awkward. But it felt good because it was a single chamber bladder system. So it felt good. It was wide. So you didn't use a ton of pressure. And then I moved to another cuff that was able to disconnect. So I was like, okay, this is cool. So I tried that, and immediately when I put it on, I didn't feel the same. It was a multi-chamber bladder system, so it was not meant to occlude an artery. So that has inherently a lot of drawbacks. One being not being evidence-based enough, at least for me. So I used that. Not very long. Then I went back to the other single chamber bladder cuff just because it felt better. Mm-hmm. Yeah. So, and then, we designed, our current cuff, so that we launched that in 2017. And then we launched education courses last year, early of last year. So June, I believe May or June of last year, we started launching clinical education courses for BFR. And the things just really took off from there, just because people really were digging the fact that it was applicable. Our education is not designed to just, drink out of a water hose and just get research all day. That people don't want that at courses. So they felt it was very applicable. And then it started to leak into the professional ranks. People, they were using $5,000 units at some of these, NFL and NBA teams, and they were just like, hey, we want something that's not tethered to an IV pole. They just felt that it was very awkward. It was very not natural. And they're like, we can get the same results by using these at a fraction of the cost, but the athletes prefer it just because they could travel with it. The athletic trainers loved it because they could travel with it. They didn't have to worry about a battery dying or anything like that. So that's kind of how that's kind of where we are now, and we're always constantly editing the product. This is generation 2. We're working on generation 3 right now. It's going to be electronic, more affordable. It'll measure, limb occlusion pressure and things like that. So that's kind of how we are now, and going forward.
I mean, we just finished up our workout, and I'm actually still a little shaky.
For sure.
I'm sitting here wondering if my arms are twitching too much to pick up weird sounds, and watching me on the video. I don't know. We paired that with a little bit of pre-workout from Phil Heath Labs. We did the Dream Killer workout pre-workout, and we do have a full video of this. So if you're watching us or listening, be sure to check out the video of our actual training, and you can watch us nearly pass out from how much blood flow we had in our limbs. And it was very, very intense. And the weight, like you mentioned, the weight you use is so much less. I know when we were doing some leg stuff, I've had a couple knee injuries myself, 2 knee surgeries. I can't really train as heavy on that leg as maybe my quad would allow me to, because then I start to get to the point where my knee then has the pain. So in this case, I was able to use much lighter weight, not have any joint pain whatsoever, and still really feel all the blood rushing into the muscle, extreme vascular benefits to the cuffs themselves. And I thought that was cool. So, I mean, talk a little bit about how many people from the rehab perspective, what types of injuries or things are you seeing, whether it be in the athletes that are out there, or even just like you said, even in the PT world. Tell us a little bit about that.
I mean, right now the main consumers are physical therapists and athletic trainers. So they're the early adopters to this, and rightly so. It was really it's amazing for early stage rehab. Whether it's 2 weeks out, 3 weeks out, 4 weeks out, it really helps stave off that atrophy that occurs with any surgery. So naturally, they can progress in their rehab much quicker, as opposed to just laying there for 2-3 weeks not being able to do anything post-op. So the surgeons love it because it makes them look like rock stars as well, and the PTs look great. So it really, at the end of the day, it's all about the patient and getting them back to their normal activities, because we're in about 1,000 to 1,500 clinics right now, and majority of them are not athletes. The majority of them are just everyday people that just want to get back to normal activities, lifting their grandkids or doing laundry or doing just normal activities that they just want to get back to. So if you can get them back quicker to that, I mean, they're all for it, and it's safe. It's, you obviously you got to have the proper precautions. There's screening tools that are involved with this. It's not something that you're just going to take out and then just slap on your next patient, right? Especially in the clinical world, there's going to be a lot of comorbidities that you have to screen for, like a DVT or pregnancy. Obviously, you don't really screen for pregnancy. It's pretty obvious sometimes. But
well, you do, but you have to pee on a stick.
Exactly. Yeah. But yeah, I mean, it's things like that. So there's a laundry list of absolute and relative contraindications. Obviously, if you're not a clinician, you're just, a bodybuilder or an athlete or whoever that just want to use this just on yourself, obviously get cleared with your physician first. We're not advocating this as, just something you just take out of the box and start using. You got to get clearance from your physician. And that goes for any exercise program, any resistance training program. You got to get physician clearance.
So my thought on a couple of things, and maybe you can tell me if people have had experience with this, was number one, after a fracture has started to heal, increasing that bone density around a fracture. I think this might be something beneficial, especially like a mid-shaft fracture. Mm-hmm. And then secondarily, the other thought that comes into my head outside of the obvious ones we've kind of talked about would be osteoporosis. Have you had any success with that?
Well, OA, I mean, not indirectly, but OA they're seeing huge benefits with it. Offloading joints, as you kind of talked about in your video when you're using it, how light loads and offloading your joints if you have past surgeries. How long ago was your surgery?
Like probably one of them was, I think, 15 years ago, and the other one was 17. So
I mean, you're talking offloading joints from post-op to surgeries that you had 15 years ago that you might still have lingering issues with as far as your joints go. So you're offloading those joints but maintaining or growing muscle. You're getting hypertrophy in the muscle. I mean, that's awesome. It helps a lot of people, whether young and old.
So I was going to ask you too, you had mentioned here off air that there's so much attention coming to this type of science
Sure.
from the high level athletes, like in the
Yeah.
NFL, the NBA specifically. You mentioned
Sure.
on your social media, DeMarcus Cousins, Kristaps Porzingis. These guys are rehabbing through.
Who signed waivers and they said we can use their name.
Oh, okay, yeah. Well,
so we're clear on the legal thing.
yes.
They did sign waivers and they are allowed to use. We're allowed to use their name.
so
no
certain protocols that they may be looking at right now in the early part of their rehab, and then how does that unfold as it matures into something closer to the season? So how would you guys go around protocols?
Well, the thing that sets our product apart is that we can measure limb occlusion pressure, right? So we can standardize the amount of pressure for that given patient or athlete. That's huge because a lot of cuffs, they just go by what's called an arbitrary pressure. So there's 100 to 200 millimeters of mercury of pressure being applied to a limb. Well, that's a huge range. Some people are occluded at 150. We had a guy in one of our clinic or one of our workshops that it was occluded in his lower leg at 150, and he was healthy. He was a healthy individual. He's a PT, and so that's why it's important to be able to personalize pressure, especially in the clinic, but also with athletes. You don't want them working out at 100% occlusion. So when we say 100% occlusion, we mean complete venous occlusion and complete arterial occlusion. You don't want to be exercising at both of those being occluded. That's not safe. So what we're doing is quantifiably knowing exactly how much arterial restriction we're getting.
Okay.
So I think that for some of our viewers who maybe aren't as familiar with the anatomy on this, just for some basics, the arteries have muscular walls. The veins do not. So the veins will collapse much faster than the arteries. The arteries take blood away from the heart. They drive it to our distal extremities. So that's what's pushing our blood to our hands and our feet and whatnot. And then the veins take it back to our heart so it can kind of get reoxygenated eventually by the lungs. When you're trying to do a training session like this, you don't want to limit the blood coming from the arteries to the distal extremity. You just want to limit the amount of venous return back up to the heart because it spreads everything. We know from the bodybuilding world and hypertrophy world and the muscle training types of things, we want to increase that amount of blood flow. There's some growth hormone release, and we're going to talk a little bit about some of the hormones.
Sure.
And even
there's some studies out there. We mention it in our courses. It's good. It's not strong. It's not like we don't feel it's the main driver of the hypertrophy. It's there, for anybody to read, and it's there. But I think time under tension is huge. Mechanical stress is big for this, and it's at low load, which is crazy. That's the biggest thing. It's low load hypertrophy. Those are the main big thing. Time under tension. There's a metabolic effect, sure. Is the growth hormone huge? Not really. It's endogenous. It's not like you're not going to test positive for growth hormone on a blood test. But how much your body can make. And then testosterone, there's going to be increases, but there's also increases in testosterone with the regular resistance training. There's things you can take away. I wouldn't say it's our main selling point, but we do mention it.
What do you think in regards to fascial stretching or anything along those lines? Just because there's been training regimes, if you will, or entire systems based upon how much you can stretch the muscle, how much blood flow you can get into the muscle to increase that stretch. And their thought process was, at least at one point, was it stretching the fascia and then allowing for further blood flow to get in there on a normal basis. Is that something that you guys see happens?
We haven't looked at it yet.
Okay.
We don't really mention it too much in our courses. We just, a lot of times in our education courses and in our market materials, but mainly our education courses, there's so much research on BFR. You can go down a rabbit hole that you never get out of, right? And it's almost like drinking out of a water hose at some of these courses. There's so much research that if we start to mix joint mobilization and fascia, there's really not a ton of research, if any, that at least I know of, is in regards to BFR and fascia specifically. There might be some stuff with, actually, I don't know of any. I know they kind of started to look at it with voodoo floss, but by the way, as a PSA, don't do blood flow restriction with a voodoo floss. It's not the safest thing in the world. More often than not, you're probably going to occlude your limb with a voodoo floss and try to do blood flow. I'm not saying not to use it for mobility purposes, but if you're using it for blood flow restriction training, in our recommendation, don't do it. I mean, it's your body, you can do what you want with it, but in our recommendation, I would say no.
Yeah, and we're always looking to maintain safety for our listeners and for our patients. So,
so I was wondering, because when we were out training today, you'd mentioned that since we're using such a low load for the training, that we can implement this multiple times a week. So what's the typical frequency that you can see someone using this?
2 to 3 times a week is usually what's normal. I've seen some people try to use it up to 6 times. The research says anything over 3 times a week for a given muscle group really isn't beneficial. So, in a given workout, it's good to use it as like a gasser, like as the end as a finisher. So if you're doing maybe 2 or 3 exercises for the biceps, then you save one of those exercises and do it with BFR as a finisher, because you're using such low load.
Can you imagine going through a full workout and then doing what we just did? Because today what we primarily did was we tested something for the biceps, something for the triceps, something for the quads, and something for the hamstrings. And that was it. But that was a ton. I mean, it was like you said, we're shaking like a leaf a little bit sitting here.
Shaky. Yeah, and I think that we talked a little bit about it on the video about the rep scheme at quite detail. But, we're talking 30 reps for round 1 with a fairly light weight, then a 30-second break, then 15, 30-second break, 15, 30-second break, and then 15. We were even doing some unilateral stuff for that last one because we were already so tanked. It would be very difficult, I think, to even use the weights that we did, which were already 25% or lower of our max. It would have been difficult to do that after a full workout.
Yeah. No, I mean, it's the goal really, especially, whether it be clinical or healthy population, is to get the failure as optimal as possible, right? So in the rehab world, you're trying to get that muscle to failure. I mean, that's how you grow, right? You're not going to grow by not getting to failure more often. But that's the goal of BFR, getting to failure as optimal as possible.
So let's talk about some. You don't have to pick on any specific names. You mentioned the Voodoo Floss. We already picked on them a little bit, but let's talk about some of the other products that are out there and why the Smart Tools product is so much different. Yeah, I mean, there's always going to be competition coming out in the marketplace. That's what's awesome that's what's awesome about capitalism, right? It drives down the price of first to market products that are crazy expensive, and then you're going to get knockoffs. You're going to get cheaper products into the market, which is fantastic, and it's better for the consumer. It's going to be better quality product at a lower price that can get the same effect as a more expensive product. There's right now, I think there's about 15. We're just talking inflatables, right? So when I say inflatables versus straps, there's a bunch of different straps you can get out on like Amazon or just Google. It's just nothing more than basically a knee strap, something, or wrist straps or anything like that. So it's which is, you can get by with it. It's not optimal, but you can get by. And they're like $40-$50. And then there's the high-end one. It's a computerized. It's about $5,000-$6,000. It was really used for the operating room, and then they kind of adapted it to BFR. And it's an auto regulatory system. It's FDA listed, as is ours. We're in the expensive unit, which will go unnamed. We're FDA listed, so we feel that's very important. It's not just for marketing purposes. So some companies out there, again, I won't name any names, but they use that as a marketing play, and they're not even FDA listed. And I'm just like, at some point, integrity has to come into play here. So we're FDA listed. The expensive unit is also FDA listed, and that comes with a quality control system. We're always. Not always, but we can be audited, and our quality control systems can be audited, and our fulfillment center and manufacturing centers can be audited, and make sure everything is safe and make sure we're using high quality products and materials. So
I feel confident in our products. We have such a low return rate that I feel like we're obviously the best out there, just because it's so close to what the evidence is saying is safe and effective, but it's so cost effective. So that's how I really feel confident in not only where we are now, but where we're going. We're constantly evolving and constantly wanting to make a more easier product to use, and make it more affordable. So that's the goal.
So I've used another unnamed.
Oh, you can use it. You're a customer,
okay.
quote unquote.
So I've used the Be Strong bands previously. They actually came with the purchase of some recovery boots that I had. And I will tell you right now, the Smart cuffs are not even close. They're so much better. If you guys have ever used inflatables, when you strap them on and then when you inflate them, there's a certain pressure that should be maintained through the whole exercise that you're doing for the duration of that 3 to 4 to 5 minutes.
Sure.
The Be Strongs, I'm not going to lie, they leak and they just at some point become so weak that you're back to just like you didn't even have a band on at all, which is super frustrating because you're in the middle of such a metabolic stress and you're just trying to get the goal of doing it is to be able to withstand that 30, 15, 15, 15 rep scheme.
Sure.
They didn't lose anything the entire time when we were working out
we
today.
looked at that. We looked at that when we were developing it. And, one thing that was coming back was that these things have to be durable as hell, right? Because they're being put through the ringer. Case in point, Stanford University. My guy, Chase Phelps, he was the director of applied science or sports science at Stanford. He was just like, dude, we're putting these things through the ringer every single day. Him and Corey Schleichinger, who used to be the head athletic trainer for Stanford. Now he's with the Phoenix Suns. He was just like, he's like, this is the only product that is holding up to what I'm putting my guys through.
That's awesome.
And so we take pride in that you can beat the hell out of it and still keep going.
I can attest to that. They were awesome today.
And that's so important because, again, from a rehab perspective, you definitely don't want anybody who we need to record that stuff. I mean, we need to have a very accurate measurement on something so we can see progression. Then simply, as you were stating, if you're in a workout, think of all that time you took to do this, and then you're going to have it deflating. I had one of the mattresses, one of those Smart mattresses or whatever, and it was an older one. It's not the current model that's out there, but I set it at maybe like 80, and then by the morning it's like 65. I'm like, this thing's a piece of crap. So I can imagine that was bad for the mattress. And this is the same type of thing. You take all this time, you spend all this money on something, and then to find that it just doesn't work, it's really disappointing.
It's frustrating. It's demoralizing. But yeah, I mean, that's another big thing that separates our products is to measure that LOP. So when we say LOP, it's that limb occlusion pressure. It's getting it to full occlusion, and then we back it off by a percentage of that. What's great with that is that you can play around with those percentages and weight. You can rate ratios, right? So high pressure, low weight, or high pressure, high weight, low reps, or getting to failure. Again, it kind of goes back. So you can take that patient to, just doing body weight, low pressure or high pressure, but just doing body weight to, gradually maybe lowering that pressure and increasing the weight to get them lifting heavy again. Because there's a huge misconception. People think that this is replacing heavy lifting, and it's not. That is not the goal for BFR. It is an accessory tool for both rehab, but also just athletes to offload joints or to prevent muscle atrophy in the clinical population.
Well, listen, while we got you here and we're talking about some tools, I mean, the big instrumentation thing out there is Graston. I think you can say that.
Sure. Yeah.
They kind of we're a bit more first to market, but the tools that
they're the Kleenex, as I say.
Exactly. the tools that you guys have are phenomenal. Both Jim and I have been using them for years now. But just to touch on this, we won't go into super depth.
Sure.
But so many people right now, outside of we went on a rant about non-professionals using certain techniques, but so many people out there think that they're experts in soft tissue instrumentation all of a sudden.
Right.
You see the Instagram videos, you see the pictures. Oh, I just got my Graston session, and these people are purple. I mean, they're straight up purple.
Yeah, it's crazy.
Just please re-inform our folks here listening about the importance of not damaging the tissue and what this instrumentation is really meant to do.
Yeah, we don't teach it. the traditional way in regards to we're breaking down scar tissue. You feel that scar tissue, just because the research, there's nothing to say that it does that. What it does do is it definitely takes the stress off of the practitioner's hands, right? Because as you guys know, as chiropractors, I was a former chiropractor. It's still licensed, but I don't practice. But your hands are your livelihood, right? So if you can take a little bit of stress off your hands in any given patient, why not, right? And if the patient likes it, great, then do it. It creates a little bit of a window where you can start loading them, right? So if they're in pain or they have limited range of motion, if you can increase their range of motion just a little bit and then start loading them, then what's the problem? Like, I get what people are saying, like, oh my God, the evidence is so scarce on it, this and that. It's like, well, at what point does it become like, are you strictly just evidence? Are you strictly looking at the literature? Are you relying on any of your clinical experience or any of the patient preferences? Sackett's, it's Sackett's model of evidence-based practice is, it's literature. It's also clinical experience, but it's also patient preference. Some say that's an equal tripod. Some say it's a funnel, leading you to, that patient preference. Either way you look at it, as long as you, in my eyes, is if you can increase the range of motion and get that patient loading, where's the harm?
Yeah.
Obviously, you don't want them purple. As soon as they start to get at least a little bit red, and you don't want to be, it's not a meat tenderizer.
I think that there's so much more neurologic benefit to
Absolutely.
it that, I know you discuss in your training. And if you are a practitioner watching this, be sure to find a Smart Tools training. They come around all over the country and international. So, if you get a chance and you're a hands-on practitioner, go take one of these courses. Before you put metal to body, you really should be knowledgeable in what you're doing. And then same thing if you are a practitioner and you plan on ever taking any of the BFR training to your patients, be sure you know also what you're doing, because that's so vastly important. And let's talk a bit. Number one, your website info. Tell us a little bit about how people sign up to take the courses and buy things.
So smarttoolsplus.com has everything you need on there, right? So it has all the courses, it has all the product sales. We have distribution all across the U.S. I think we're in about 7 or 8 distributors in the U.S. We are launching in Europe later this year. We have about 5 distributors in Europe. We're in Australia, China, Southeast Asia, Japan, launching in India next week, actually, for ISTM. And then working on South America right now. It's a little bit problematic, but taxes and customs is fun. We're trying to spread, proper BFR education, because, with social media, things can get propagated very quickly, and a lot of incorrect information can get out there. Most notably, notoriously, people putting BFR cuffs on their calves drives me crazy. Nowhere in the research does it say that it's safe to put BFR cuffs on your calves. There's no point to it. You're not getting any additional benefit. If you want to work your calves, put it in the same location that we say to put it in. It's proximal hip, so as far up in the hip as you can. And the same thing with upper extremity. You don't need to put it on your wrist or your elbow to work your wrist extensors. Just put it between your deltoid and your bicep, and that's fine. Just keep it easy. Keep it simple. Right?
I think that we have kind of grown accustomed to asking each of our guests about mindset, and just separating just a bit. You have now transitioned away from chiropractic practice, and you're running the business full time. You just don't even have time to practice if you wanted to. Tell us a little bit about the mindset that goes into what you have done, not only professionally in the chiropractic field, but now taking every single morning, waking up and saying, here's what I have to do to my business. Here's what I have to continue to do to be successful. Just talk about any tips, tricks, or mantras you have.
I think it's very similar. There's a competitive drive there, right? So you just want to wake up in the morning and beat the other guy. Mm-hmm. At the end of the day, it's not about, who has more product. Well, it is, but who has more product out there, or who's sending the right message in regards to the actual product itself and the actual activity that the product is doing. But it's always not about the money, right? To me, it's getting the patient better. I love getting emails from patients saying that, oh my God, like this was a huge game changer for me. I I got back to playing basketball in 8 weeks, 7 weeks. Way before my surgeon was incredibly impressed that I got back so quickly, and it was lasting. It wasn't something that was temporary. But from an entrepreneurial perspective, I want to bury my competition at every point, every chance I get. Like I don't want an equal playing field. I want to bury them. So I have no qualms. What's the old adage? If your competition's drowning, stick a water hose in their mouth.
Well, with that being said, can you tell us a little bit about the Gen 3 that you told us about earlier?
Yeah, so the Gen 3 product that we've been developing for BFR, we're trying to make it lower priced. We're shooting in the under $200 range, so it's more affordable for everybody, and making it easier. So maybe can't give out too much in regards to the actual unit itself, but it'll be much more user friendly.
Cool.
Nice. Yeah.
Guys, get anything else?
Thank you for coming down.
Yeah, no, it's awesome. No, it's fun.
This is a blast. Well, I'm definitely going to do the training again.
And we'll be attending a course hopefully here soon.
Yeah, we got a course coming up at Pure Physio up in Strongsville, Ohio. We probably have up to about 50, 60 courses on the website right now.
Okay.
And we're going to expanding. We're going to double that next year between strategic education partnerships and just courses on our own. So we just want to spread proper BFR education and making it affordable. We don't agree that you have to take a course to buy a product. That was the Graston model for the longest time, and that's other companies do that right now that force you to take a course in order to buy a product, and that's just wrong. It's in your scope of practice. There's no need for that, and it just drives me crazy. So we're just trying to we say, hey, you know what? You can buy our product, sure, but we recommend taking a course. So you're doing it properly, but optimally. So it's best for your patient. So.
Are you teaching in all of the countries that you had mentioned earlier, IASTM, so instrument assisted soft tissue mobilization? Are the cuffs courses going to those same countries, or is it
same countries? Yeah, where we have distribution. Yeah, okay. I don't teach though. Ed LaCara, my director of education, will be the first one to say I'm not allowed to teach because I'm terrible. It's really bad. I am not an instructor. It takes a special person to teach. I am not that person. I'll be the first to tell you that. It's awkward. I'm not good. They keep me in the office.
That's all right. Well, we're glad you're there because we've learned a lot.
Appreciate it.
You've definitely taught us a lot. So don't sell yourself too short.
No, I'm stupid.
Well, listen, guys, we're going to take a break. Again, thanks to Dr. Nick here at Smart Tools.
Thanks for having me.
SmartToolsPlus.com is the website. We'll have all that linked here. We will be putting both the video of us training up along with this. And if you're listening to our podcast on your iTunes or whatever, make sure you go on to the YouTube channel, check out the videos, because this is probably even more important than any of the other ones, that you got to see the video of how this stuff works and how pathetic Dr. Jim and I were trying to do these simple little weights. Takes your ego, and really you got to check it at the door if you're going to train like this. So again, thank you, Dr. Nick. And
thanks for having me,
guys. We'll be right back.